on the issue of mental health and psychosocial support. Let me say this, Madam Speaker, that I have been speaking about the issue of mental health formally since about 2020, when I came back from Germany and I saw that COVID was going to hit St. Kitts and Nevis. I was not in government, I was not even in the parliament. If for us to remember, and let me just update us or to jog our memory a bit, that in 2020, I started the first COVID update. It was myself, Dr. Patrick Martin, Dr. Lawrence, and Dr. Archibald, before the then government had started any formal updates. And out of those updates, we asked the government to make sure that they put together a team that can update the people on the COVID situation. It took them a few weeks after to put it together, but it was subsequently put together. The reason why Dr. Archibald was included is that from the scientific data that I had looked at, I recognize that mental health will be an aspect of health that will be greatly needed, or mental health care would be greatly needed. Not only that, but that if we had not dealt with it, or if we had not dealt with it, it would be significantly troubling for our communities. And so that is why she was included. By that time, I had started also my foundation. And that foundation dealt with a lot of the social issues that, of course, I know would have led to mental health issues as people would have gone through a difficult period during COVID. Madam Speaker, that is why I'm saying today that this is not an issue I'm just speaking about because there are obvious things that are surfacing. I kept saying over the last year and something that in the United States, the data showed that 50%, at least 50% of the adult population had referred some mental health issue. That's a very high percentage. I then said, if we see that in the United States, we can expect it to be here, whether or not we had collected the data. But I think that to some extent, because nothing dramatic had happened, that people would have heard it and would not have registered. It's not the fault of anybody. It is how the human mind functions. Things only become very important when something significant happens for most people. It is part of the human condition. So it's not to criticize anybody, but just to show that I had been speaking on this and seeking to get the public sensitized as to what would be the repercussions of a post-COVID St. Kitts and Nevis and a post-COVID world. I would like to say that the world is still struggling with the mental health issues that occurred during COVID. Imagine you were locked down, separated from your normal social interactions. Many persons lost their jobs. They did not know how they would pay their mortgages. And on top of that, you didn't know at that time if you would contract a deadly disease that would lead to your death and the death of your family. That was a lot for the human being to deal with. Extreme psychological pressure that those who had never experienced mental health issues would experience some. And those who had and have become stable, they can again become acute. And those who had greater mental health issues, like psychoses and so forth, that they would become more acute. And every single one of those happened here in St. Kitts and Nevis, but not only here, but throughout the world. And so we started to work earnestly to deal with the mental health issue. We expanded the Drug Council because one of the issues with mental health, people tend to use more substances to cope. And I want to thank those at the Drug Council who have been working tirelessly hard over the last year and a half or so to get up to speed with what we expect to be an avalanche. But they're ahead of the game, Madam Speaker. Within the mental health sphere, we now have 2 psychiatrists working full-time at the JNF hospital. It had been very rare to have 2 full-time psychiatrists at the hospital at any point. Madam Speaker, the other thing that we would have done is that we started to engage child psychologists, to have a permanent child psychologist on the team so that the children's mental health would also be looked after. Madam Speaker, so that is even before dramatic things would have happened here in St. Kitts and Nevis. And the other thing is that we have in the budget, which was debated last year, an appropriation for the construction of a mental health / counseling center, which would be out for bid and which would be constructed throughout this year. Why am I saying all of this, Madam Speaker? Is to let you know how responsible we are, and we saw exactly what was coming and how we would be able to deal with it. But are there gaps? Of course. And that is why we want to fill those gaps.